Okay, Dennis, why don't you start?
Good afternoon. I'm Dennis Galucki. Welcome to the 500th Imagine Greater Buffalo program and our 122nd YouTube Imagine Greater Buffalo program hosted by our downtown cultural treasure, the Buffalo and Erie County Public Library. We're so glad you've joined us today. This program is created by the Center for the Study of Art, Architecture, History, and Nature, and ImagineLifelongLearning.com. Now, before we get started, a little housekeeping. Everyone watching will be muted and your video turned off. If you have a question or comment, please type it into the chat box and we'll go through them at the end of the presentation. We are recording this program so you can watch it again later on the Downtown Central Library's Facebook page and their YouTube channel, and we certainly hope you share the link with others. Now, a bit of context. The theme for years, we started this program in 2009, December of 2009, as a monthly program. Very quickly went to every other week. And then for the 2011, the fall of 2011, when the National Trust for Historic Preservation was in Buffalo, we went to a weekly program and have been a weekly program ever since. We do take off for the summertime. Now, our theme was to imagine Greater Buffalo as a premier North American cultural and nature center. Then we added a second theme and did it in conjunction with the Wellness Institute of Greater Buffalo that was located in City Hall. A fellow by the name of Phil Haberstroh was the head of it. And then we developed a secondary theme of imagine a healthy, wealthy, and sustainable community. And to do that, we have to imagine place-based lifelong learning. And that brings us to today's speaker. Scott Scanlon is a longtime friend of the library and of this Imagine program, having worked with Phil Haberstroh and myself in talking about our rankings, for instance, in the Robert Wood Johnson Foundation, our county rankings, which always seemed low in the state. And so we said, let's focus on that and see what we can do to try to imagine what we can do different to go up in those rankings. Now, Scott is the Quality of Life and Solutions Journalism Editor at the Buffalo News, where he works closely with colleagues to tell stories that help readers better navigate their lives. He previously served as the Western New York Refresh Editor for 10 years, where his reporting in the news focused on health, fitness, nutrition, and family life in Western New York. Today, Scott joins us to do just what we said, to discuss how the Robert Wood Johnson Foundation's health rankings and what Erie County can do to improve those rankings. Scott, let's talk about those rankings.
Thanks, Dennis, and thanks very much to the Buffalo and Erie County Public Library System for inviting me to do this presentation over the last several years. We have made some inroads, and before we start the slideshow that I put together, the PowerPoint presentation, just a couple of major observations here as we go. The Western New York health rankings are slightly better now than they were a year ago. We'll go through that a little bit. But as a whole, they still remain the worst in the state as a region. There are 4 of the 8 counties in the bottom 15 of our state: Niagara at 51, Orleans at 55, Chautauqua 56, and Cattaraugus County at 61. And that's out of 62 New York State counties. Erie County actually has fallen a slot from 46 last year to 47. Now, in Erie County, the strengths include our clinical services. That means the services that are available in the health community, as well as ancillary when you think about wellness. We have more access to exercise opportunities and more primary care providers per capita than the state average, as well as a lower percentage of uninsured residents and a higher percentage of high school graduates and those who attended college. But it also ranks, unfortunately, higher than the state average in categories that include adult smoking, adult obesity, income inequality, and we're higher in the percentage of single parent households and death from injury. So there are a few new things that are in the rankings this year, and so we'll go through those. So Caitlin, go ahead to the next slide. So as I said, we still remain about the least healthy statewide, and a number of different things are weighed and measured in reaching this consensus, which the Robert Wood Johnson Foundation and the Population Health Center at the University of Wisconsin, who compile these rankings, do so for every county in the United States, including in Puerto Rico. And so they measure all sorts of statistics, as well as our health behaviors. And they also measure income inequality, children in poverty, educational status, screenings, and some of the other things we just talked about. Next slide, please. And this is how they determine these rankings, where Erie County and other folks or other counties are. Through health outcomes, through health factors and policies and programs. And you'll see some of the major categories and subcategories that are used to come up with their conclusions. Next, please. And this year, for the first time, the rankings are looking at civic infrastructure and civic participation. Next slide, please. And what they're looking at here, the infrastructure includes schools, parks, libraries that help us stay connected as communities, as well as policies and practices that foster belonging. They're also looking at participation, so the ways people engage in community life, whether that be through political activities such as voting or advocacy, or community activities such as volunteering or mentoring. And I think you'll see some of what they've discovered, the rankings have discovered, is that communities that are healthier also have greater access to some of the civic items that they examine. Access to broadband, for instance. Healthier communities happen to have greater. They have greater access to libraries, to parks and recreation facilities, adequately funded school. That is striking how important that schools are when you're looking at these data. The healthiest counties versus the least healthy counties across the country. And then organizations for social association. How important are all of these things now after a pandemic that changed the country and the world, and certainly had an impact in Western New York. Next slide, please. They have examined statewide, and you'll see all these little squares and semi-squares that in several categories here that show where we are. You'll have to squint your eyes a little bit. Voter turnout across counties and among states, with more structural barriers to civic health. And what you will see is that Western New York as a whole tends to be kind of in the middle, but some of the counties in the southern tier have lower voter turnout. And two of those counties are at the very bottom of the rankings, the health rankings in our region. Next slide, please. A variation in socioeconomic opportunity. You'll see there again that Western New York ranks in some cases a little better, and in some cases about average. It's notable that the counties in there that are ranking a little bit better look also to be a little bit higher on the rankings in Western New York. Next slide, please. Regions with the type of longstanding discrimination and disinvestment. Cattaraugus County is ranked 61, as I said, out of 62 counties. And notice that regions with longstanding disinvestment in tribal areas is helping to, in Cattaraugus County and in other counties, Niagara County, for instance, in Erie County, do have an impact on health outcomes and these county rankings. Next slide, please. And so by the numbers, these numbers are using data that were also used to compile the 2022 health rankings, so they're about the same. Our length of life in Western New York falls below the statewide length of life, which is 80.3. And you'll see here that all of the counties are lower. In Erie County, there's a 2.3-year difference in longevity. For Blacks in Erie County, the life expectancy is 72.4, almost 8 years less than the overall state average, and almost 6 years less for whites in Erie County. Next slide, please. And while Erie County ranks in the top half of the counties in terms of the clinical health outcomes, it's in the bottom half in terms of some of the overall behaviors. I've already mentioned that we're 47th ranked here in the county. Buffalo stands at number 17 in terms of the most segregated regions in the country, and it continues to be highly segregated, and a little over 1 in 4 city residents lives in poverty, and the number is that percentage is considerably higher for children. Next slide, please. Erie County health behaviors, and here's a mixed bag. Adult smoking is higher than the state average, but it did go down. Each of those percentages went down 1%. 1 percentage point over the last year. Adult obesity went down 3 percentage points in Erie County, but it still remains higher than the state average. Our food environment index improved over last year. Physical activity went, that percentage point, inactivity, sorry, that percentage point went down 2%. Access to exercise opportunities, as you'll see, is higher in the state. Excessive drinking went up 2 percentage points during the last year, and sexually transmitted diseases went down considerably. It seems that when you look at a couple of these numbers, you can see how the pandemic drove some of these numbers up, and how now that it's over, it's driving some of the other numbers up. Next slide, please. Erie County child and infant mortality used the same data this year as last year. And you can see that the impact here is higher on communities of color. Next slide, please. The same is true for health behaviors involving teen births and preventable hospital stays. Next slide, please. Child poverty, 19, up 1 percentage point. For Blacks, 39, up 1 percentage point. For Hispanics, up 5 percentage points over the last year. And this is countywide, that's not citywide. And for whites, 9%, which is the same as it was last year. Next slide. A little bit of context. As challenging as our lives can be these days, we can be happy that we didn't live in early 19th century England or anywhere on the planet 123 years ago. The average today is still considerably higher than it is or than it was in 1950. and it increased slightly over last year. Next slide, please. And health rankings are more are about more than just health. They're also about wellness, and there's a lot that goes into that. Next slide, please. The system has been changing through the pandemic. It will continue to do so. Telehealth has been used more often. More health insurers are providing money or other awards for those who go through health screenings and take other steps toward healthier behavior. Nutrition is becoming more important. And the Buffalo Niagara Medical Campus, and particularly in the wake of the May 14th mass shooting last year on Jefferson Avenue at Tops, we're starting to see a greater emphasis on health equity and human equity in our region. Next slide, please. So some of the fitness strengths in the region, we have outdoor classes year round, really, because the November project, if you're willing to get up early, meets on Wednesday mornings about 6:30 or so. Fitness in the parks and Canal Side and the Outer Harbor will be starting right after Memorial Day. And yoga and Tai Chi continue to be very popular in the region. Next slide, please. And so there's also a personal responsibility that comes with these health rankings. Making better choices individually helps build community health. It's more important to add life to your years than years to your life. Medication can help, but it only goes so far. Action counts more. And too many people, I think, particularly during the pandemic, but always, sometimes lean in on alcohol and other unhealthy substances to self-medicate. Moderation is key, and the winning combination is holistic healthcare, working and complementing modern medicine. Next slide, please. Global Wellness Day is Saturday, June 10th, and this year, Dance Magenta is the theme and the hashtag. So obviously, there's a stressor or an emphasis across the globe to move more. Other things to consider every day is stop what you're doing and calm down for a while. Take a deep breath and smile. Smile in spite of everything. Next slide, please. Walk for an hour if you get a chance. I always say, if you're tired, walk. If you're hungry, walk. If you're stressed, take a walk. Next slide, please. Drink more water. Often that's why you feel full. Next slide, please. Read reliable journalism. I know I have a new job, and I'm still focused on healthcare, wellness, and how that ties into the quality of life. And we have been focusing with the Solutions Journalism Network, the New York, Michigan collaborative on stories involving caregiver solutions. Next slide, please. Here are some helpful websites as you're looking at your personal health or trying to get a sense of things. And the county health rankings have a lot of interesting information that I can talk about a little bit more during the question and answer period. The CDC is a good place to look, and mayoclinic.org is a really good source for any sort of health issue that you or a loved one might be having. There's my email address and my phone number for any of you who would like to reach out to me. And I'm not sure if there's a next slide or not, Caitlin. You would know. Nope, that will do it.
Okay, and do it. You manage to do just that. Thank you, Scott. You summarize a very detailed report. I invite people, if they're at all interested, just search for Robert Wood Johnson Foundation county rankings when you get to their website, and you will be have at your fingertips a great deal of data for any part of the country, every part of the country, and you can become informed. Let's put it that way. As people ask us some questions, Scott, what is your sense of the community's focus on this? I mentioned in the beginning, used to have a champion right in City Hall with Phil Haberstroh. Sadly, he experienced I believe a heart attack and died in November of 2020. Has there been any follow-up to that? Is there a city or county focus that you're aware of, or is it falling on your shoulders, Scott, to sort of be the beacon of information and focus on what you would think every county and city would want to improve their ranking in this Robert Wood Johnson Foundation county ranking? What's your sense of the current times here in town?
So I would like to use this as a Bass Pro type mentality when it comes to this question. Yes, Phil, my mentor, has been a huge loss in the health and wellness community. But what I would suggest is that what has been happening now, and May 14th has been a real wake-up call, is that that civic engagement end of things, something that the creators of the county health rankings are emphasizing this year. That has been happening for probably the last half a decade to a decade in Western New York. There are a lot more people who maybe aren't quite as visible as Phil used to be, working in the background at addressing our health disparities, our health behaviors in a lot more comprehensive ways. So there are more foot soldiers right now than there probably ever have been, who are trying to make a difference not only in the health care space, but in the health and wellness space. And I think this is going to be helpful going on. This civic part, some of the things they're looking at and are emphasizing are complete streets, more parks and playgrounds. A lot of the things that we're seeing on the Buffalo waterfront and in other communities.
Good. All right, Kate, do we have any questions?
I've got it. We've got someone asking, Scott, can you please expand on, is it more important to add life to your years than years to your life theme? So they're asking for more information on what that means.
Well, Dr. Bruce Trone, who unfortunately has gone on to the University of Kansas, told me that for a story several years ago. And really the premise of that is, do you want to live long or do you want to live long and healthy? So if you want to get more life in your years, don't always look for a pill or a surgery to get that done. Be proactive, eat healthier, get enough sleep. Take the steps that, if you need to lose weight, do the things that help prevent so many chronic health conditions are pretty much universal. And we all have a pretty good sense of what they are. It's a matter of kind of walking the walk instead of just listening to the talk.
Okay. Another question is, because our region has an older population, do you think that that's really swayed and put us either at the top or the bottom, however you want to look at this, that's our ranking has a lot to do with having an older population?
That's I think this is one of the foundational things this year that the county health rankings are getting at. It's too easy for all of us as a community to say, well, these rankings are skewed because, well, Buffalo is a poor city. Buffalo has a number of disenfranchised folks who push that number up. So I'm living in the suburbs and I may be a white resident. Why should I care about this? Why should I worry about this? The same, we're all in this together in the region. And I think, whether we're older, whether we're Black, whether we're kids, or whether we're living in Clarence, or in a rural community here, we've got to take a look at health, see what we have available, improve. And I try not to use this word in stories, but improve that infrastructure so that everybody can benefit from the things that we know make us healthier. And when we do that, it will lift the whole region, from Lake Ontario all the way down to the Pennsylvania border.
Someone is observing that they are seeing more people walking and they are seeing more people paying attention to what they're eating and putting in their system. So they're kind of just observing that they feel that people are very much trying to live healthier lives.
Yeah, and when you think about changing these health rankings and the outcomes, you are seeing some numbers in Erie County and elsewhere starting to improve. They're moving in the way that you would like. And so what has changed here? The waterfront, much more accessible to families. These outdoor fitness programs and health insurers and others making major steps. The Ralph C. Wilson Jr. Foundation, which has now renamed LaSalle Park and is making all sorts of improvements. We're going to have a new amphitheater in the Outer Harbor this year. Art-wise, culture-wise, that's improving. It's getting people out of their houses and apartments, getting them on bikes. Think about what we've done in that space over the last 5 to 10 years here with Go Bike Buffalo and Slow Roll Buffalo, Buffalo Slow Roll, and other organizations. So yes, it is actually making a difference. And the more sustained this is, and the more excited people get, the healthier we're going to become.
Someone asked, is there something the other regions are doing to promote longevity that we're not doing?
And this is where the civic infrastructure comes in. And so I thought this was kind of interesting, something we could consider here in Western New York. So there is, let me see if I can find it in my notes. There is a city in Oregon, Cornelius, Oregon, a suburb about 25 miles outside Portland, who noticed that it had a growing Latino population during the last decade, but they were not involved in community affairs at all. So City Hall started to have town hall programs in Cornelius in largely Latino neighborhoods. And they were starting to grow larger and larger participation, particularly when they were conducted in Spanish. And the city officials there started hiring people who were Spanish, who spoke Spanish, listening to the people in that community, and encouraging them to participate in community events and community boards and in government boards. And after 10 years now, roughly half of the people in Cornelius are Latino on the boards that are serving that community. And it just a little, you think about what's happened on our west side. How is government here reaching out and listening to people who are new immigrants, to people who've maybe been here for decades but don't feel heard? We're starting to see that again. I think that's accelerated since last May, but those are things that are making a difference elsewhere.
Okay. That's all the questions that we have, but I do have a couple comments, but I do want to say from me, Scott, this was really an interesting topic for Dennis to have you on again, because we're learning more each time, and it's making us all realize that we need to think about not only ourselves, but our family and our community in terms of being healthy. With that aside, so thank you very much. I have a couple of people who have put in the chat that they want to congratulate Dennis and the library for 500 programs strong. We know this really started around 2009, right? As a sort of a it's still part-time, but more of a part-time. I'll let Dennis kind of talk about that, but several people have put in that they're really proud that you have taken the reins on this, Dennis, and brought in excellent, interesting speakers like Scott and so many others to really talk about what makes our community thrive and important and preservation and how it helps us mind and body. So cheers to you. I am clapping. Dennis and all of the guests that we have had 500 guests, I guess, but thank you. I don't know if you want to have some closing comments.
I do, Joy. Thank you. And just to wrap it back, Scott, my thanks to you for doing this. You would think we would all have a vested interest in not only living longer, but living better, obviously. And that is happening. And one of the things that it strikes me, there is a general awareness out there. And to equate it to like a football team, you get some draft choices and you think you got a better team, but then you discover all your competitors got draft choices and they're better teams. And maybe across the nation, our ranking and the state stays where it is because, yes, there's improvement, but relative to each other, you may not be changing that much. I'd like to hope that's a possibility and really the only way we can all look at it. Secondly, Joy, and this program wouldn't exist without the Buffalo and Erie County Public Library, your staff doing a great job of making it happen, especially in the era of COVID when we converted. We were only shut down for a few months from March to September and then reopened under this virtual program. So as I mentioned, this is the 122nd virtual program. You've got a nice catalog of YouTube stories. All those charts you showed, Scott, the people that are on this, I hope they look at them again and share them with their networks. That one, especially on infrastructure, as you pointed out, a new way that Robert Wood Johnson Foundation is looking at it. That's the sort of thing that is in the daily news around parks, around people trying to design a city where it's easier to do the right thing, the best thing from a wellness standpoint. So it isn't just a few folks in the corner waving a flag for this. It becomes part of the culture, And that's why the theme that I came up with, we've got to imagine, literally imagine a healthy, wealthy, I want to improve the wealth of the area, and sustainable. That's certainly the buzzword of the day. You do those three items, and then the library can figure out how it's this communication, lifelong learning center, if you will. We've got 37 branches here. We've got libraries in all those other counties, how it can focus on that, connecting it with school libraries, et cetera. That's the ingredient that we can do the best we can to communicate to the community. And this is a small effort, but an important effort, I think, that you've done in compiling this, Scott. So my hat's off to you, and thank you very much. All right, folks,
Thanks.
we go to 501 and head towards whatever life has to offer for future milestones. But next week, what you'll find, it's our garden walk. And right from the beginning, C-SAAHN has been a supporter of that garden walk. And this year, it's now broadening into a traditional garden walk and an East Side garden walk, two separate. So the co-chairs of both of those garden walks will be with us next week, Samantha White and Beth Kreutzer. And we're going to hear about that. If you look on the video archive at the library from last year's garden walk talk, you'll see it's by far the most widely watched, viewed program. It's beautiful to see images of Buffalo literally in bloom in the end of July. Those of us that did a lot of walking during COVID discover that there's gardens of sorts of a form all year long in this area. And we're a flat area. It's easier to walk and ride a bike. So nothing stopping us but our own desire to really get out, take deep breaths, enjoy the community, and you'll go a long way to improving your health and frankly, the community's health. People see other people doing things and then they're inspired to do it themselves. So that's how we'll finish it up. Scott, thanks again. Joy, thank you and your staff. And folks, most importantly, thank you for joining us as often as you can and sharing these with your friends. I'm Dennis Galucki. Be well and good day.